It is that time of year. Spring allergies are here. We're talking about congestion, runny nose, watery eyes, what to do and how to know if it's allergies or something else. So Dr. Evelyn Lomasney with Cone Health Allergy and Asthma Center of North Carolina is here to help us tackle those questions and much more. All right, so let's just start with the basics here, right? How does somebody know if what they're dealing with is allergies or something else like cold, flu, or COVID?
That is a great question. I usually tell my patients that allergies are almost never associated with a fever. So if you're having fevers, I would think viral or bacteria infection first rather than allergies. And secondly, allergies tend to be associated with a lot of itch symptoms, itchy throat, itchy eyes, itchy nose. Now you can get this in upper respiratory infections, but if you're having those symptoms without a fever, I would think more allergies.
Okay, let's talk about maybe some symptoms that could be like red flags for seeking medical attention, and then kind of tell me where the symptoms and where do we seek the medical attention?
Sure. If you're having fevers, high fevers associated with any kind of respiratory infection that's been going on for more than 3 days or so, I would say that needs to seek medical care. I'd start with your primary care, but if you're having shortness of breath associated with that, then you start thinking of more urgent evaluation. From an allergy standpoint, we certainly have our asthmatics, and if they're having wheezing associated with their allergy flares, you definitely want to get into your primary care, or if you're established with a pulmonologist or an allergist, to seek them out to get better control.
Okay, when you feel bad, the last thing you want to do is go out and look for medicine. So are there like some home remedies or things that we can do to provide relief and ease of the allergy symptoms before we go to the store?
Sure, that's a great question, a difficult one. I think the first mainstay treatment of allergies is prevention and starting there. So things like doing the avoidance measures for pollen, showering after you come in from the outside, keeping your windows closed in your car, in your home, are all things that you can reduce the pollen exposure you're having. After that, you're probably looking at medications to help alleviate your symptoms, but you can certainly reduce your exposure overall.
Okay, well then let's get right to the medications then, if that's what's going to help. So what over-the-counter medications do you recommend for managing your allergy symptoms, and then how quickly do they actually work?
Sure, most of these medications work fairly quickly. You should see relief within a day or so of starting them. Sometimes they do take a couple days. We always recommend trying a long-acting antihistamine. Specifically, look for the ones that don't make you drowsy and are marketed for that. And then I think people really underutilize nose sprays, especially the steroid nose sprays. I will say when you start those, they can take up to a week to really see a benefit. So those are one you want to give a longer try for.
Okay, and when we're talking about these over-the-counter like allergy medicines that you're talking about, the 24-hour antihistamines and stuff, how long should we take them? And do we take them until symptoms end, or do we take them all allergy season long?
So that's a great question, and that's one I think an allergist can help you out with, especially once we figure out what your known triggers are. It kind of depends. If you're a tree pollen patient, you might only need it in the early spring. But if you're allergic to trees and grass and weeds, you're really looking almost March through October that you're going to have symptoms. So I think that's a very personal decision. I do recommend my patients to tend to be more proactive with medications, especially if they're pretty symptomatic. A lot of people sneeze or wheeze and then they take medications, but if they can take them to help prevent those symptoms, they might feel better overall.
Sure, I'm sure. All right, so can your body build up a tolerance to allergy medicine like it can do to other things?
That's a great question. I would say the research says no, that there is no tolerance you build up to antihistamines. However, anecdotally, I hear this a lot. So if a patient feels like their antihistamine isn't working, I say, hey, let's try another one and see if that makes a difference.
Okay, so not supposed to do that, build up those, but if you're finding it doesn't work, just do something else.
Yeah, there's no harm in trying something different.
Okay, any concern with folks over the age of 65 taking antihistamines for their allergies?
This is another great question. We definitely don't recommend any of the antihistamines that can make patients drowsy, and those tend to be the older ones. The newer ones that are on the market tend to have less of an effect. Lastly, I would consider any drug can react and interact with any other drug. So if you have an older patient who's on lots of medications, any over-the-counter you're going to buy, I recommend talking about it with your primary care doc to make sure we're not missing something that could happen.
All right, and so a lot of these are all over-the-counter things. At what point should you actually contact your provider?
I would think if you're taking a daily antihistamine plus minus a daily nose spray and it's not working for you, I would definitely reach out to make sure we're not missing something else. I would also consider, I tell every patient can come see an allergist if they want to reduce their lifetime use of medication, because we definitely have more tools in our toolbox than are just over the counters.
Okay. Are there times of day that outdoor allergens are just worse than others?
Yes, certainly. Early in the morning, the pollen count's probably higher, so you want to avoid kind of early morning. But pollen is released throughout the day, unfortunately, and so it's really kind of trying to limit as much exposure as you can during those high pollen count days.
Okay, so early in the morning, later at night, simple steps otherwise that we can do to help reduce pollen exposure?
Sure, just remember that the pollen gets on your clothing, it gets on your bags, it gets on your pets. So anything that you can reduce bringing that inside your home is helpful. People may change their clothes, they may shower, wipe off their paws of their pets, take their shoes off, just so you can reduce tracking that into your home can be helpful.
Okay, so when you're talking about clothing recommendations to minimize allergens, that's what you're talking about, taking your clothes off from outside.
Really changing your clothes, because there's not much that can reduce how you're going to get exposed clothing wise outside, but that pollen can sit on your clothes and cause you to have symptoms for hours after they come on your clothes. So taking them off so you're not bringing it inside your house can be very helpful.
Gotcha. All right. Are there certain foods that can either worsen or alleviate some allergy symptoms?
That is a great question. I know this has been out there and it's something we're seeing more frequently is pollen food syndrome. So it's not really foods that are going to increase your allergy symptoms, but there are certain pollens that can cross-react with certain foods. For example, birch pollen is kind of the pitted fruit. So an apple may make these people's mouths itch. And that might be a reason to go see your doctor or see an allergist, because we have treatment options for it and can actually improve the symptoms in these patients.
Okay, all right, did not even think about that. Now, let's kind of just review again. If someone tries like these recommendations, you know, showering before bed and taking their clothes off so that they don't bring the outside in and not letting their dog sleep with them and stuff, and they still feel bad, what should they do?
I think that's the time where you ask for help. If you're doing everything you can at home and you're still feeling bad, you don't have to. We have prescription medications, we have other treatment options, and I would go to seek care from your primary care or an allergist. We're always here. And you can make these appointments on the Cone Health website, www.conehealth.com/appointments. And we're happy to help you if you're still kind of suffering out there.
Okay, and I want to go back to this because some people, you know, swear by one certain antihistamine, other people swear by another antihistamine, and maybe you pop one and you're like, that didn't help me at all. Is one day enough to try it? How many days should we really give it to see if it's going to work for us?
That's a good question. I would give it a few. Some people are more sensitive. Even with some of the non-drowsy ones can make people drowsy. So I would definitely look at side effects when you're dealing with antihistamines. And I would probably give it at least 3 days before you say it's not working.
Okay, and that is for the actual pills. What about, like you talked about the nose sprays and you said the steroid sprays? Well, how will we know that it's a steroid spray, and then how is that used different than other like nasal sprays?
Sure, so there's actually multiple nasal sprays available over the counter. There's the saline rinses, which really just kind of clean out the nose. There's a nasal antihistamine out there now. There's the nasal steroids, that it'll say nasal steroid on it. And then there's the nasal decongestants. The only one I don't recommend to take regularly are the nasal decongestants, because they don't actually treat any of the inflammation in the nose. They just kind of decongest the nose, but there's a rebound effect. And if you use it too often, you're going to find that your allergy symptoms get much, 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 much worse.
Gotcha. And you said for the steroid spray, we do need to give that about a week's time or so.
Yes, it builds on itself as it's treating and controlling that inflammation. And really that is one that should be used daily if you're an allergy sufferer.
All right, we just got about a minute left. You got any final thoughts of allergies and things that we should know?
Allergy season's here. The tree pollen count's high and moderate, and we're seeing early grass season. So now's the time to start these therapies to get ahead of the curve as this allergy season comes upon us.
All right, before we see the yellow pollen everywhere, make sure you're starting to take your allergy stuff. Thank you so much for your time and your expertise. If you